So now I'd like to take a step back from all this chemistry and cell biology and talk a little bit about the structure of a psilocybin journey itself and relate that to what we now know about what's happening in the brain during the psilocybin journey. And then a little bit later, we will return to that serotonin 2A receptor when we talk about some of the more lasting changes in brain chemistry and brain wiring that occur after the psilocybin journey is over. So let's take a couple of minutes and just discuss the various components of an effective therapeutic psilocybin journey. And here I'm not detailing a menu of things that people should do in order to pretend that they are a psilocybin-assisted therapy coach or to do self-administered psilocybin therapy. That is not what I'm doing. What I am trying to do is to share with you the consistent components that are present in the clinical trials that have demonstrated the effectiveness of psilocybin for the treatment of depression and for other compulsive and addictive disorders. And those data, meaning the specific data related to those trials and the references themselves, we'll get into a little bit later. But we can't really have a conversation about psilocybin and what it does without talking about the so-called set and setting, as it's often referred to, that is known to at least bias the probability of the journey being beneficial and not a so-called bad trip. So what are the variables that make up an effective and safe psilocybin journey? And again, when we say safe, we're referring to people who are not prone to psychotic episodes, that don't even have a first relative that's prone to psychotic episodes. We're talking about people that are 25 years or older. We're talking about people that, for instance, are not taking antidepressants that impact the serotonin system. This is very important to understand. I think a lot of people don't know this, but as far as I know, all of the studies that have explored psilocybin for its ability to positively impact brain chemistry and mood and function have required that people either not be on or abstain from antidepressants in the weeks leading up to the psilocybin journey. Now, that is not to say that if you are currently taking SSRIs or something similar that you should cease taking them and do psilocybin. I'm absolutely not saying that. That could be very, very, very dangerous, if not catastrophic. Anytime you're going to take anything or stop taking anything for that matter, you do need to consult with your physician, in this case a psychiatrist as well. So let's talk about psilocybin journeys from the subjective side and from the structural side. And when I say the structural side, what I mean is, what does a psychedelic journey actually include? And here the words set and setting become extremely important. Some of you may have heard that set and setting are the foundation of a well done or even therapeutically beneficial psychedelic journey. And all of that really hinges on safety and outcomes. So set refers to mindset, the mindset of the person taking the psychedelic. And setting refers to, as the name suggests, the setting in which they're taking it in and the people that are present there. So let's talk about setting first. The setting for a psychedelic journey needs to be one in which the person under the influence of the psilocybin or other psychedelic is safe. That means no windows they can jump out of. That means no streets of moving cars they can run out into. That means no opportunity for getting lost. That means no opportunity for getting into bodies of water. In other words, it requires that there be at least one and perhaps even two or more other individuals who are not also taking psychedelics, right? Who are not also taking psychedelics present in that setting to ensure that the person taking the psilocybin is not going to harm themselves or others. I say this not to sound like a school teacher, even though technically I'm a school teacher, but because, of course, I don't want anyone to get harmed. And I'm also aware that there's a lot of interest nowadays in psychedelics such as psilocybin becoming legal or decriminalized for their therapeutic applications. And if we look back to the late 1960s and early 1970s, when the Controlled Substances Act was invoked to make psychedelics like psilocybin illegal, one of the bases for that was not just the geopolitical unrest at the time and things like the Vietnam War, but also some highlighted instances in which people did not take set and setting into consideration, took things like LSD, stared at the sun, went blind, or took psilocybin, went out and harmed somebody else. Again, these are very, very isolated instances, but these are the exact sort of instances that lead to criminalization or the fact that things like psilocybin and LSD and MDMA, for that matter, are considered illegal. Again, I completely acknowledge that there are a number of different factors making them illegal. We could have a whole discussion about that. We talk about the drug trade, the war on drugs, but right now is such a critical time in the history and the use of psychedelics for therapeutic and other reasons. And getting setting correct, meaning making it absolutely as safe as possible for the person taking the psychedelic, is absolutely key. And one of the best ways to ensure that it's safe is to have responsible individuals who are not under the influence of psychedelics present in that environment. So that's one component of setting. The other component of setting that we talked about earlier, which turns out to be very important, is the opportunity and perhaps even the bias toward the person on the psychedelic being seated or ideally lying down and being in the eye mask, or at least having their eyes covered, so that they can combine any spontaneous visual hallucinations that occur with the various thought processes that are occurring while under the influence of psychedelics. This is far and away different than, quote unquote, taking mushrooms and going into the woods, or taking mushrooms and going to the beach. What we're talking about today is the use of psychedelics for particular brain rewiring outcomes that, yes, can involve things like changing one's relationship to nature or changing one's relationship to somebody else by interacting with nature or somebody else. And while I'm not trying to diminish the potential value of those sorts of psychedelic journeys, if we look at the scientific data, the vast majority of it, not just in the clinical setting, but in terms of understanding the safety and efficacy and positive rewiring of brain circuitry that allows people to feel better, to understand themselves better, and to interact with life in more adaptive ways going forward out of the psychedelic journey, involve these very, let's say, subdued settings that are typically in one room, a closed environment with one or two other individuals acting as sort of guides, or helping the individual by talking to them from time to time if they feel like they have to sort through a particular aspect of the psychedelic journey that's creating anxiety. And we'll talk about the contour of the psychedelic journey that almost everyone who takes psilocybin at somewhere between 20 and 30 milligram dosages tends to experience. But the setting that I'm describing is not just a list of things to, make sure you're safe, but they're really the list of things that also ensure that one can get the maximum benefit out of the psilocybin journey.